The baby is laying on the back. Okay.
When Vanessa Pinnell learned she was pregnant, she was terrified. The single young woman admits until recently she had little understanding of how to care for an infant.
Feeding the baby, bathing the baby, making sure the baby is not around anything dangerous.
It all seemed so overwhelming, she says, and she had no one to guide her until she was referred to what's known as the mom van. Twice a week, it brings prenatal and postnatal care to mothers living in some of Washington, D.C.'s poorest neighborhoods.
They're depressed. There are substance users. There's domestic violence that's going on in their lives. And being able to identify those things and then help the women get through those are the things that help us to get those women to do better.
The outreach seems to be working. 8 years ago, Washington had one of the highest rates of infant mortality in the United States. More than 14 deaths for every 1,000 births. Today, that number's been cut in half. But despite the drop in numbers, African American women and their babies are still at greater risk of dying during childbirth than white women and their children. Dr. Lamia Sawyer blames that on persistent racial inequalities all across the U.S.
The reason that there is such a big difference is because of socioeconomics. It's because some people cannot get access to health care.
That lack of universal access to basic medical care is just one reason the U.S. has been identified as the worst industrialized country for mothers and infants. According to the Save the Children report, the U.S. has the highest number of what are known as first-day deaths. That means babies born in the U.S. are 50% more likely to die in the first 24 hours of their lives than babies born in all other industrialized countries. That's why programs like Washington's Mom Van are so critical for young mothers like Pinnell. She says it's given her baby
The best possible start and myself.
But not everyone has access to that kind of service. And that's something public health officials say needs to change if the U.S. hopes to improve its infant mortality statistics and give all its mothers and babies an equal chance to thrive. Kimberly Halkett, Al Jazeera, Washington.